Welcome to the Full Stack Medicine podcast, where we explore the latest advances in medical research and treatment. This episode is provided by i3 Health. I am Katie Cook. Ulcerative colitis is a chronic inflammatory bowel disease affecting approximately 1.5 million people in North America. The introduction of newly developed therapies and tailored treatment strategies based on patient and disease-specific factors have allowed for a more personalized approach to achieving disease control and remission. i3 Health's virtual escape room follows Sean, a 32-year-old man with ulcerative colitis, through his treatment journey with Dr. Benjamin Cohen, co-section head and clinical director of inflammatory bowel diseases in the Department of Gastroenterology, Hepatology, and Nutrition at the Cleveland Clinic. In this interview, Dr. Cohen shares a preview of the insights on novel therapies, biomarkers, and personalized treatment strategies that learners can explore in the escape room. To learn how to complete the escape room and obtain free CME credit, visit i3health.com/UC-escape.
Good morning and welcome to today's interview. Today we have a really exciting conversation planned for our virtual escape room activity on ulcerative colitis, and I'm joined by the escape room chair, Dr. Benjamin Cohen, to share a preview of some of the insights explored in the escape room. Dr. Cohen, great to talk with you today.
Great to talk with you as well.
Absolutely. To start off, would you like to introduce yourself and share what you do?
Sure. So Dr. Benjamin Cohen. I'm a gastroenterologist and specialist in inflammatory bowel diseases. I'm the co-section head and clinical director for inflammatory bowel disease at the Cleveland Clinic in Cleveland, Ohio.
Amazing. Looking forward to talking today. So to set the stage for some of the topics that are going to be explored in the escape room, what are some of the biggest challenges that clinicians face when diagnosing and treating ulcerative colitis?
So we've made significant strides in the management of ulcerative colitis. However, despite an explosion of new agents for treatment of UC, we still have a treatment ceiling where patients may not fully respond to current therapies. And whereas we used to struggle with getting patients on any advanced therapy, the challenge now has really become how to select the right therapy, how to monitor and know when to switch versus optimize therapy. And then with more options, there's increasing complexity and shared decision-making, which is challenging in clinical practice when physicians are managing large patient panels with limited time during a patient visit to go over all of this. So I think education for both patients and providers is really critical to navigate this.
Absolutely. And along these lines, what are the first signs and symptoms of UC to be aware of, and why is it important to identify and diagnose patients early?
So early diagnosis is increasingly being recognized as a critical factor in achieving good outcomes in the management of ulcerative colitis and IBD in general, because it's a progressive disease. So early diagnosis and treatment has also been associated with higher rates of disease control. And on the other hand, long-term inflammation can lead to complications, including a disease extension in ulcerative colitis, increased disease activity, dysplasia or precancerous changes, blood clots, and functional impairments, among other things. So recognizing red flag symptoms early and referring patients to gastroenterologists and confirming diagnosis with colonoscopy is key. And I think we highlight this in the escape room. And some of these red flag symptoms include rectal bleeding, unintentional weight loss, nocturnal stools, urgency and/or incontinence, and family history.
Definitely. And we know that individualized management of patients with UC is so critical. And the escape room follows a patient named Sean through his UC treatment journey. How does his story help to illustrate the complexities of managing UC in real-world practice?
Yeah, I mean, Sean's journey is not atypical of what I see in practice every week. So Sean initially started with less extensive disease that extends after disease was not controlled. And despite starting him on effective advanced therapy, his disease was still difficult to control, requiring monitoring, optimization with treatment switch, and coordination with the multidisciplinary team to manage disease complications to eventually get him in a stable remission. So in practice, it really is a team effort to manage IBD, and Sean highlights that.
Absolutely. And one of the topics explored and one of the learning objectives for the activity is to utilize various endpoints, including symptomatic, clinical, endoscopic, and histological, to evaluate therapeutic response. Why is it important for clinicians to understand and apply all these different measures when treating UC?
So treating to target has really become the hallmark of chronic disease management, including with ulcerative colitis. And we know that symptoms alone are not a reliable indicator of inflammation and disease activity. There's a significant functional overlap with inflammation, which can drive symptoms, and knowing whether inflammation is controlled will ultimately change the treatment approach towards improving those symptoms. If inflammation is still present, then we know we have to optimize anti-inflammatory treatment, whereas if inflammation is controlled, we may focus on more irritable bowel syndrome treatment, for example. So for this reason, our treatment targets incorporate objective markers of inflammation, such as the lab biomarkers C-reactive protein and calprotectin, and importantly, endoscopic healing, along with improvements in symptoms and quality of life.
Great to know. And in the escape room, we also explore a lot of the new and emerging therapies and evolving strategies for UC. So how do you personally navigate treatment sequencing and tailor therapy to individual patients' needs?
So this is a tough one. As treatment options and complexity of care has increased, it's only further highlighted the importance of shared decision making with patients. Patients have to be a partner in the process to get their full buy-in and compliance with the treatment plan. So understanding their disease activity and risk factors for progression are the first step in advanced therapy selection. And then we need to understand how the chosen therapy may fit into their life, including from a cost or insurance perspective, as well as a mode of delivery perspective. Additionally, we need to educate patients on the risk benefits, which are often individualized to the patient in front of you based on their various comorbidities. There usually can be more than one good option, but finding what's right for the patient really does require a personalized approach and a strong team to be able to implement it.
Absolutely. So what knowledge and insights are you most excited to share with learners during the escape room?
I think Sean's case really highlights the importance of shared decision-making and team-based care, which we've talked about a little bit in this interview already. So as we've discussed, there's often times when more than one possible approach to management may be available, but we need to individualize it to that patient in front of us. And ultimately, setting up a clear monitoring plan with the patient that incorporates treatment goals which are important to them will be key in getting their disease under control and achieving the best possible outcomes.
Definitely. So as we wrap up this interview today, any parting messages you'd like to share or anything you'd like to say to encourage people to take the escape room?
I think, management of ulcerative colitis is continuously evolving with new therapies, getting more complex, and it's hard to keep up with what new therapies are and how they may be incorporated into our treatment algorithm. So this is a really fun way to be able to keep up to date with the newest treatments and treatment strategies in an interactive format.
Amazing. So thanks so much, Dr. Cohen, for sharing these insights with us today. We're really excited to take the escape room, and I encourage everybody to visit the i3 Health website to learn how to participate. So thank you again.
Thanks again.
Thank you for listening to this Full Stack Medicine interview for Mission Remission, individualized, evidence-based strategies to optimize outcomes in ulcerative colitis. To complete the escape room and claim CME credit, visit i3health.com/UC-escape. While you're there, you can check out our other free educational offerings. And don't forget to follow us on social media for free CME, NCPD, and CPE, as well as news, exclusive interviews, and more.